the stroke awareness is still poor in the community level.
There is no doubt incidence of stroke is increasing all over the world.
If a stroke occurs, there is hardly any time. Patient has to be immediately brought into a stroke-ready hospital.
Stroke is one of the difficult area of medical field because of two reasons. One, so on one hand, the science and knowledge of stroke is rapidly progressing. A lot of treatment options, new treatment options are rapidly progressing and updated day by day, which is implemented with a lot of multi-specialty hospitals all over the world. On the other hand, still the stroke awareness is still poor in the community level, both among the public as well as among the doctors. If you take the public, if you compare the myocardial infarction, the awareness of stroke among the public is still poor. Still a lot of people don't know what is stroke, what are the symptoms of stroke. They don't know what to do if the stroke symptoms happen to their own relatives. At the same time, from the medical side, the doctor side also still there are a lot of unawareness, poor awareness about the stroke, recent management and updates.
There is no doubt incidence of stroke is increasing all over the world. In the Western world, it is estimated to be 26 to 27%. But in India, they say it's exponential. It is 100% increase. So how are you going to deal with it? Incidence of stroke is increasing. So does our knowledge, skills and technology to take care of stroke victims. Stroke is a disease where we need a well-orchestrated team to get the best outcome for our patients and return them to near normal life. The focus is returning them to near normal life. It is time for us to create more centers of excellence in stroke. And also, we have to think of people living in rural areas. What happens to them? That means we have to develop different programs like tele-stroke program. I'm happy to say that at GKNM, like Dr. Gnanashanmam said, we provide a comprehensive stroke treatment for our patients. In the coming weeks, we will be inaugurating biplanar cath lab exclusively dedicated to treating stroke patients. That, combined with state-of-the-art intensive care unit, will benefit our patients.
Stroke needs public education more than anything else because you have to prevent stroke, and for preventing stroke, you are going to probably discuss today exercise and diet and lifestyle and stress-free life. That you have to tell people. People don't know. That's one. And more important is that if a stroke occurs, there is hardly any time. Patient has to be immediately brought into a stroke-ready hospital. Stroke-ready hospital means that hospitals where strokes can be treated. Strokes cannot be treated in every nursing home.
Myself, Dr. Rasminajan Padi, consultant neurointervention radiologist and organizing chairperson for today's event, Annual Stroke Update 2019. So regarding this program we are doing every year because stroke is one area which keeps on evolving and the treatment strategies keeps on changing and the guidelines also changing. If you'll see in 2018 what the guidelines were, and in 2019 these guidelines have changed. So to keep ourselves updated as well as our fellow doctors and neurologists, those who are managing strokes, to keep them updated, we are conducting this program, Annual Stroke Update, every year. And this year our theme is Therapeutic Challenges in Acute Ischemic Stroke. And here we are doing a lot of sessions on what are the challenges in diagnosing strokes, and if you diagnose the stroke, what are the challenges in managing it, be it thrombolysis or thrombectomy. And this year we have Professor Dr. Subhash Kaul, who is a renowned strokeologist and a neurologist with us, and we are having a lot of delegates all over India, most of them neurologists and general physician as well. And this program mainly focuses on updating our knowledge as well as the guidelines about stroke.
GKNM is organizing a third stroke update. Stroke, as you know, is a very important problem which is affecting our country. It basically means when circulation to the brain is suddenly stopping, which can cause sudden loss of movement on one side of the body, which we call stroke, what is also called paralysis. You can have sudden difficulty in talking, sudden difficulty in walking. Sometimes it can cause unconsciousness and even death. And most important causes of stroke are high blood pressure, diabetes, high cholesterol, smoking. So therefore there is the purpose of this update is to educate the doctors and nurses on this so that they can spread the education further. And the second important thing is that if a stroke occurs, then these days we have got modern treatments which can dissolve the clot in the brain. And those treatments have to be given within first few hours. So in this science is very much progressing. So this hospital is this GKN hospital is one of the leaders, one of the pioneers in these new treatments. So to discuss about these new treatments, to share the experience of the other doctors like myself, Dr. Subhash Kaul from Hyderabad, and other doctors from Chennai and all who have come, this conference has been organized. And the purpose is to educate doctors as well as eventually educate the public about the importance of stroke, and it is early treatment.